Welcome to Bulletin Brief Surgeons' Voices from the Front Lines. With me is Melanie Fritz. Melanie is a fourth-year medical student at Boston University who has had her research accepted for poster presentation at our upcoming virtual annual clinical congress. Firstly, Ms. Fritz, I'd like to congratulate you on your accomplishment.
Thank you so much, Dr. Wexner, and I'm very grateful to be able to present my findings at the Congress this year.
Well, thank you for sharing those findings with us. Perhaps you could start by telling us the name of your project and then a little bit about how you came to conceive the idea of your project.
Absolutely. So the title of my project is The Rise and Fall of Gender Identity Clinics in the 1960s and 1970s. And I originally conceived of the idea as a result of some personal reading that I was doing, actually. I was reading a book called Stone Butch Blues by Leslie Feinberg, which is a seminal work of fiction in the LGBTQ community. And the protagonist in the book undergoes a mastectomy for gender-affirming surgery. And it's set in the 1960s and 1970s. So I started wondering how accessible an operation like that would have been at that time. And in the course of my research, I found a lot of interesting things, including that there were many gender identity clinics that actually arose at various academic centers between the 60s and 70s and then kind of fell off or closed. And these clinics were multidisciplinary collaborations between psychiatry, surgeons, and other specialties. And they often offered gender-affirming surgery to a small subset of the trans community as part of research on the transgender community at the time.
So the clinics were established for research purposes?
Yeah, so the cited motives for most of these were for research purposes. One of the things that came up in my research that I really appreciated was the role of surgeons and all the physicians involved really as advocates for the transgender community. There was a huge need at the time, as there still is today, for gender-affirming surgery for trans folks. And it was very cool to see how physicians kind of saw themselves as advocates for their patients. And that lines up with what I've seen in a lot of my mentors who today see themselves as advocates for their patients. But the cited reasons for the clinic's opening was generally for research to determine whether gender-affirming surgery was a positive and useful intervention for these patients.
Well, given the research that was done and your research in looking into these clinics and programs in the 60s and 70s, were you able to find the results of the research?
Yeah, so a lot of them were published in often psychiatry journals, but some surgical journals as well. And they almost universally, not completely, but many of them showed positive results. What they were really focused on at the time obviously was surgical outcomes, but also was the psychiatric outcomes of these patients to see if gender-affirming operation helped to relieve some of the gender dysphoria they were feeling. And there were a huge amount of results that showed that it did.
Are any of the programs from the 60s and 70s still in existence today? Or if not, could you tell why they're not in existence today?
Many of them closed. Only 2 of them that I researched had a very explicitly defined reason for their closure. In one case, it was the Baptist Medical Center in Oklahoma that was voted to close by the local Baptist convention. And the other one was Johns Hopkins University, which was the first clinic to open and had a somewhat controversial closing related to a new chair of psychiatry who was pretty adamantly against transgender surgery for transgender folks. The remainder of the clinics didn't explicitly announce their closures, and so the reporting at the time in news and in medical journals seemed to indicate that they were having financial difficulties in terms of funding these operations, because as they transitioned from research operations that were being funded often by the state actually to trying to get insurance reimbursement, that was a big challenge for these clinics. So those are some of the reasons that I think they closed. As far as the ones that are still in operation today, it's a little hard to trace the lineage because the documentation gets a little spotty around the 1980s. The closest one that seemed like it may be able to trace its roots to the clinic in the 60s and 70s was at Stanford. And I believe there is a clinic operating that is in the same region and may be able to trace its roots to the early Stanford program, but it's not entirely clear.
You mentioned the word challenges, and although there certainly are challenges to the clinics and programs themselves, including financial ones, clearly political and others, certainly the challenges are to the patients. So here are patients who are enrolled in programs. Normally, if you're a patient, you have longitudinal care. A patient of mine who has colon cancer, ulcerative colitis, Crohn's disease, they continue coming for years and years for continuity of care. Certainly the same is true for pretty much any surgical discipline. What happened to the patients?
That's a great point. Often for these clinics, they would actually continue to follow patients after what I'm referring to as their closure. When I think about closure, I'm thinking that they've stopped enrolling new patients, but they did in fact continue to follow them, especially with the multidisciplinary care with psychiatrists for up to 15 years. Some clinics had their follow-up periods.
To switch gears a little bit, I'd like to ask you about the format. So you initially had your poster accepted, you're all excited to go hang it somewhere in McCormick and Chicago and have people walk by and ask questions, and now you're faced with a virtual format. What were you told about how to organize and present your poster for the virtual clinical congress?
Right. So we submitted a PDF of our poster just as we, would have printed that PDF to display in Chicago. So we submitted that to an online portal, and then we were instructed to create a brief 3 to 5 minute PowerPoint presentation using the images from our poster to share some of the key points or key findings, which is obviously a very different format to do things all virtually. I will say it allowed me some time to kind of refine what I really wanted my message to be in a way that was gratifying in its own way.
Will you be given the opportunity to interact with Congress participants through a chat function, or is it a static presentation?
The presentation that I uploaded is a static 3 to 5 minute presentation, and that will be evaluated by judges over the next couple of weeks. And then following that, the top, I believe, 5 posters will be presented in a live judging format that includes interaction with judges as well. As far as the actual duration of the Congress in October, I'm not exactly sure what that will look like. I think it may be that the posters will be available online for viewing.
They should remain online with all of the other materials submitted for a couple of months afterwards, and not yet sure what will happen after that period of time. Well, congratulations again. That's an amazing accomplishment for a fourth-year medical student to get a presentation at the ACS. And it's a kudo to you and your work ethic. I'm sure you're looking forward to the match in March so you can figure out where you're going to go when you graduate medical school and start your surgical residency.
Absolutely. Thank you so much, Dr. Wexner. It's a true honor to speak with you and to be able to present at the Congress.
Well, my pleasure, Ms. Fritz. I look forward to seeing your poster when it's up on the website.
Absolutely. Thank you.